Hello everyone and welcome to another episode of Protrusive Dental Podcast. I'm your host Jaz Gulati. Today we'll be talking with Harmeet Grewal all about rubber dam isolation, which is so topical and so pertinent with the COVID-19, and how when we get back to work, might there be a need for those dentists who are not routinely using rubber dam isolation to start using it. Obviously, we're worried about the aerosols, but also worried about the ballistic events, i.e. when someone coughs, and that's one mode that the virus can transmit. So it's a very topical episode, if you like. Thanks for everyone who voted on the social media channels. But what you voted was for Harmeet Grewal's episode on rubber dam isolation, and the next episode will be to drill or not to drill caries with Louis McKenzie, so I'm looking forward to that one. I won't blab on for too long. I hope everyone out there, I hope you are doing really well, and I hope you're getting to spend time with family, and I hope you are thinking about the day that we come back into practice. How can we come back bigger, better, stronger? And of course, I hope we can use this opportunity so that when we head back to work, we can be fresh. My protrusive dental pearl is that some episodes ago I shared my custom screen. Now since then, Richard McKindo, shout out to him, has modified it and added the goals, the patient goals section, which I think is so important. But I had a lot of messages from a lot of people saying, look, I've got this CSV file, which is the custom screen, but I have no idea what to do with it. So I've gone ahead and made a video on YouTube about how to actually install a custom screen, and then also how to preload the custom screen with text in there, so you're not having to always type the same things. Like for example, if you take a bite wing, usually 9 times out of 10 the justification for a bite wing is to check bone levels and for interproximal caries, and that's going to be written there within the custom screen. So it's almost like a template within the custom screen. So if you're one of my email subscribers to the newsletter and episodes, you would have received an email already with that. If you're not, then when you go to protrusive.co.uk, a pop-up box will come up. Sign up to the newsletter, and the first email you'll get, the welcome email, will have the custom screen and the YouTube link of how to install a custom screen. So that's all there for you. So that's getting you to think about, when we head back to work, how can we make our note-taking better, more efficient? How can we work smarter? So hope that's useful to you. Now let's jump in with Harmeet Grewal and rubber dam isolation. Right, Harmeet, thanks so much for coming to the Protrusive Dental Podcast.
Great to have you. Me. Thank you.
You are someone who's now really doing great things in education with rubber dam, which is such an important thing. But just before we get into that, we're here in sunny, is it count as Cheshire? Chester?
I'm not sure.
I don't know where we are.
It's just up north, that's it.
We're in a Premier Inn. We could have pretended we're in a 5-star hotel, but look, we're being very real with you. And we're here for the Dawson Academy at the moment. We thought it'd be a great opportunity to learn from Harmeet. So yeah, thanks for waking up in the early hours to record this before an intense session with Ian Buckle. Yeah. For those who've done Dawson Academy, you'll know exactly what I mean there. So Harmeet, how did you get started with your journey in sort of using more and more rubber dam and getting to a point where you're feeling quite proficient with it?
It was just trial and error, really. I mean, I started using it at a time where I felt like I needed to use it, not necessarily knowing why. So the reason I was using it was thinking, all right, I've been doing these composite courses. I think I'd just done Jason Smithson's. I was like, okay, he's using rubber dam. I see the logic in this. But there's no courses out there. So it's kind of, for me, it was just trial and error. It was going in and just doing it day in, day out, making the mistakes, and then learning from them. And then over time, it's just like anything, isn't it? The more you do of something, the better you get at it. And then it kind of got to a point, in terms of where the teaching led to, it was literally a conversation with a therapist. Mm-hmm. So I was working in Hitchin at the time, and she said, Harmeet, listen, I've got a group of friends. I know you do some composite stuff, but can you teach us like rubber dam as well? Like I do a day on composite rubber dam. So I said, all right, let me put something together. So I started putting something together, and I thought, actually, like a lecture on rubber dam, people think it's like a quick topic. Actually, it fills a day.
Easily. Especially if you have a hands-on component.
Exactly. So we started talking, and I was like, I set up a course, and then the funny thing was, I was like, all right, I need to price this now, okay? Because, listen, everyone knows you do a course, there is a charge for it, okay? So, but then I said, all right, guys, this is what I'm going to do. This is how much it costs. Suddenly, everyone just went quiet. I was like, oh, okay. I thought, you know what? I've put the effort in. I've made this presentation, I've got this idea, so let me just try it.
Yeah.
Let's roll it out online and see if there's any legs in this. And I just put it out there, and I think it was within 30 hours it just sold out the first course. Wow. And then I rolled another date out, and the same thing, 24 hours, it just sold out again.
It's the demand is there, and that's exactly one of the first questions I want to ask you. With that, at least very nicely, is why is the demand out there, and why should we be using and learning rubber dam?
Okay, so 2 questions. The demand's out there because I think it's one of those things, rubber dam, that I think it's poorly taught, if it's taught at all. Okay, because it's something that's skimmed over. Now, why it's skimmed over, who knows? It could be that when people are at uni, people have biases, don't they? You know, some people justify not doing things. So it could be a tutor, you know, just saying, well, I don't think you need it, therefore I'm not going to teach it. Or it could be someone saying, well, actually, I don't know how to use it myself, so therefore I can't teach it. So it could be
I 100% agree with that. So my experience with that was the GDPs, who were also part-time tutors at the dental hospital, they weren't using isolation day in, day out. You know, I'd probably even say that having seen some of their root canals on outreach, they weren't even, let's not even get into the topic of endodontics. But so if the tutor themselves were not proficient in doing it themselves, how could they teach it to a student?
Yeah.
So I think a large part of that depends on where you were taught and whether the tutor was doing rubber dam.
100%. And then I think the other thing is why. Now, I think as dentists, we always want some evidence, don't we? We always want some evidence because
we love the nitty-gritty.
We think you'll help us sleep at night. But actually, there's always evidence for, always evidence against.
Why do you use rubber dam?
So I always base my decision on logic. All right, logic is one thing, and that's logic around adhesive dentistry. But actually, even more important is for me is reduce stress and improve clinical practice. Now, if you say to any dentist, "Can I reduce your stress and improve the quality of work?" Who's going to say no?
No one.
You know. So first, let's talk about stress. Stress is sometimes, it's not because patients are difficult. We're working in a difficult environment. Patients don't want to be difficult, first of all. You know, they know that they've got an awkward mouth and they apologise profusely, don't they, often?
They do.
But it's not their fault. But actually, the process of putting a rubber dam on, you're kind of eliminating that patient for a while, aren't you? It's just you and their teeth. Tongue's gone. Everything else is gone.
Everything's out of the way, and quite often they fall asleep.
Exactly. And then, but that stress element then. I always laugh during my lectures about the situation where you had a matrix band on and about 15 cotton rolls and your hand cramping. Do you remember that?
Yeah.
And like, you can't see where you're putting your composite, and we laugh about it, but we've all been there. So now you can put rubber dam on. It's like, oh, I can breathe for a minute.
That's the main reason I use it.
Yeah.
I feel so much more relaxed as a dentist when it's on.
Exactly.
I don't have to constantly watch everything.
That's
okay.
it.
One of my patients, I don't know if that ever happens to you. It probably has because you probably isolate so much. Is one of my patients in the middle of a root canal. I think she was diabetic and she just had to use the loo. Yeah. Like she had to use it, right? So fine.
Yeah.
Go. Come back.
Yeah.
Okay.
Yeah.
I have no fear that she's going to lick anything, saliva. It's just total peace of mind.
Yeah.
Has that happened to you?
It has, but then I guess I normally forewarn people in terms of, I'm like, you're going to be in the chair a while. This is how long it's going to be. So they kind of cotton on that. All right, I need to pay for parking. I probably need to go to the bathroom. Need to probably do this. But there's times they need to go. So
or if they need to cough. And they can just go cough to your heart's extent. It's fine. It's not going to mess up anything I'm doing.
It.
Whereas if you're not using isolation to that degree, you're always stressing about the cough. You're always stressing about the tongue. You're always stressing about the anatomy.
Yeah. I think patients cough because sometimes they don't know what to do. So a tip for everyone is your communication with your patient. Actually, for a lot of patients, they might not have had rubber dam, actually explaining before you do the treatment, so examination stage, what you're going to do. Pictures helps. And then obviously on the day, just reiterating what you said. And
do you use an analogy to explain to patients what you're doing with rubber dam by chance?
I kind of explain it, and this was one of the reasons actually for using it, was on the logic of adhesive dentistry. So when I was talking about, all those questions, why to use it, I always think, firstly, let's look at all the guys we look up to. Manier, Dici, I mean, that are just two in the world, but there's always a common theme amongst these dentists, isn't it? Any work they display, always done under rubber dam.
Always.
Must be a reason. But I'll bring it back to, what are we doing, essentially? If we're kind of being crude, we're just gluing something to something else, aren't we? So if I broke something at home, for example, I wouldn't, if I broke a plate, I wouldn't just pick it up and just try and stick it back together. I'd probably want to clean it, make sure it's dry. That's the kind, and even when you pick up a packet of glue, that's what it says, clean, dry surfaces. And that's what I think about teeth. So that's then how I explain it to the patient. Why am I using this?
That's as best as you can get. And what I always mention every episode, I end up mentioning a quote from Zach Cara.
Yeah.
But Zach always says it's like painting in the rain, and that's how.
He said it's painting the corridor through the letterbox.
That's for a small mouth. That's for a pleasure small. Oh, Zach, you're just full of these brilliant analogies. I always say that.
One.
So
I like that one.
And I always often say to it's like an umbrella, and everything is going to be protected.
Yeah.
And also, you know that horrible feeling that you have when water's the back of your throat and you're sort of flooding. You don't have that anymore.
Yeah.
And patients buy into that.
That's it. You can say things in a nice way, and then even just the explanation is like, well, actually, once it's on, I can concentrate on doing really nice work for you. Which patient's going to say, I don't want you to do nice work, Harmeet, so don't use it.
They won't say that, but what they will say afterwards is that, oh my God, this is such a new technology.
Yeah, it's funny, isn't it?
It's not even around since the 18th century.
1860s, isn't it? And it's crazy that it's taken us this long. But like I said, it's just because it's poorly taught. But back to the communication of the patient, it's just purely, I then put it on, explain to them how they can swallow, how they can breathe, so they feel in control, and then give them a few minutes before we start, and that's probably the best way. So communication actually becomes important in this, but it's important in everything, isn't it, communication? So yeah, but that's a different topic.
Absolutely. Are you part of the rubber dam police?
No. I don't want to be that person who berates people for not using rubber dam, because I think that's unfair. Because there are some instances where, actually you've got to think, is this going to be a help or a hindrance?
Let's go. Well, that was one of my questions for later. Let's go into that. So when does rubber dam actually become a hindrance rather than a benefit? Any specific scenarios for you? I have a few in my mind, but I want to hear from what you recommend.
It depends on personal comfort. So some people like say, all right, composite veneers at the moment seems to be the buzzword, doesn't it? Now, having a rubber dam on with floss ties and then you're getting resin composite in there, it's messy, isn't it? So sometimes it's not that you don't use rubber dam, but sometimes something like split dam might be a different option. It could be that you've got a wire retainer. Well, it could just be you've got heavily broken down teeth that you might not be able to clamp. Then therefore, if you can't get a clamp on the tooth, how are you going to get rubber dam on the tooth? Or it could just be emergency situation.
Yep. In the real world.
Yeah, real world is like, you've got a small chip on upper incisor. Let's be honest, easy enough to isolate.
Obtugate that.
Exactly. You could just cotton rolls and access it. Why not? I've done it. You could have a really good patient with good mouth opening. You're doing a really small occlusal cavity on a 6. I've done it without rubber dam.
The stress factor is way less in those scenarios.
Exactly.
For me, class 5s, I don't use rubber dam because I feel like it's just in the way.
Again, you don't need to. Again, maybe on the lowers it's a little bit. But again, I sometimes prefer a split dam. It's still a little bit of isolation. It's not perfect, but it's something. But yeah, I don't like to, because I understand that people, we all have different working environments, and I don't think that just because you haven't used rubber dam, therefore you're a bad dentist.
No.
And so I don't really agree. And also, I guess another thing, this is going to social media. I think people think this is them using rubber dam. People think their rubber dam needs to be perfect. If it's not inverted. Or
I'm so proud of the rolls on my rubber dam. I'm like, fine, it's isolated. I'm happy. Then when you go and make it neat and nice, it's good. It's really good for your dentist OCD. It's good for your images and stuff. But it doesn't have to be perfect. I love it.
That's it. And I always just say, like, if you're just starting, start now, get perfect later.
That's the one.
That's a phrase from a guy called Rob Moore.
Rob Moore, absolutely. And, his podcast is called The Disruptive Entrepreneur.
Yeah, exactly. So he's brilliant, and it's just people just want, and that's admirable. We all want to be perfect, okay? But sometimes just make a start, and at the end of the day, always realise what we're doing it for. It's not for a social media post, which it's nice because I do think social media is brilliant, but it's for the patient, isn't it? And then it's going to benefit us in terms of our clinical work. And then the afterthought is, all right, this could be a good tool that I use, whether that's to teach people, teach patients, teach other dentists. But that should be an afterthought, not the forethought.
Well, if you're getting started in rubber dam, then I think, like you said, start now, get perfect later. So book in that extra 10-15 minutes for your first case, for example. We're talking therapists, young dentists, but to be fair, I know plenty of not so young dentists who don't use rubber dam, who actually now clocking on that they want to use rubber dam. Just book in some extra time, right? Take it slow. It might be embarrassing the first 2 times as you're nurses trying to floss and that sort of stuff,
Yeah.
and you're struggling.
Yeah.
But it's just like you said, start now, get perfect later.
Well, that's it. It's just giving yourself that time. I think sometimes as dentists we're guilty. We don't give ourselves time. We go and try and implement something in the times that we were, doing it in previously. If that makes sense. We might have people might come to my course. They might be booking 45 minutes for the composite and then still expect to do their rubber dam now in addition. But I say just give yourself time. Like you need to,
and your nurse needs to be in on it. So if your nurse has never used rubber dam before, and you're suddenly gone to a rubber dam course, and you come back and you say, right, we can use rubber dam, and you just start using it, and the nurse is now, finding this dusty pack of rubber dam.
Yeah.
Everyone needs to be in on it.
Yeah, you've got to train your nurse, and you know what? Who would you want to be sat there all day not doing anything? It's I just think sometimes we underutilize our nurses and we don't give them the credit that they're due because one, they have to deal with a lot of us and we're not easy personalities and it's not an easy job. There's a funny thing actually, I don't want to give it's my best joke on the course, I'm giving it away now, but there's a video, I do like some pre-filmed videos of techniques on the course and then my nurse is there and I often ask people, I was like, you must think my nurse is inherently really good and I must have trained her phenomenally. And people are kind of like, well yeah, she must be, you must have trained her, And then I kind of say, well, actually, in that video, it's not my nurse, it's my mother-in-law. And it's like my wife's in the chair as the patient. And it was just literally a case, I needed to film these videos. I said, oh, you free, can you help me?
Yeah.
But he's very, like someone who's got no nursing background. Actually, just that act of me saying to her, can you just hold this and do this? It was easy.
If a non-nurse can do it, you can train your own nurses.
But then I always say to everyone, we always quick as dentists, we blame everything else. But actually, it often starts with us. And what we need to do is we haven't communicated. Often dentists, we communicate in eyebrow raises, weird eye looks, huffs and puffs.
Grunts.
But not words.
Yeah.
If we just use our words, we'd probably think, life would be a lot easier. So that's another tip. Just talk to your nurse, get her involved. I guarantee you there's lots of nurses.
Get the practice involved.
Yeah.
Get the whole practice, treatment coordinator, reception, so that in the future when they say, oh, what's that dentist like? What's treatment like? And I want people to have receptionists that know, oh, by the way, he used something called rubber dam. It's amazing. You'll be very comfortable. So that's maybe a far-fetched example, but with any treatment modality that you're offering that you've changed in your practice, the whole team should be in on it.
That's it. Treat your staff with it. I do all my any work my nurses needed. Done it for free. Done it on the rubber dam. She came from a practice that never used rubber dam. Now we use. It's to the point I don't have to. It used to be when she first started working for me. Harmeet, do you need rubber dam?
It's a stupid question
now. It's just out, and even for stuff I don't need it for.
It's just
out. She's got the rubber dam out. I was like, Jess, we won't need it.
In fact, she's probably surprised. Oh, you're not using rubber dam in this case?
She's not even surprised. She's disappointed. She's disappointed. When you say, Jess, we don't need rubber dam today, she's like, really? Because it makes her life easier as well. Which
the opposite of that is when you ask for rubber dam and then your nurse raises it like it rolls her eyes. That's when you haven't had that sort of conversation beforehand and whatnot.
It's not because they're closed off. You just need to spend some time maybe just kind of, with them and training them.
Using the right rubber dam. In my experience in the past, I want to hear what you are recommending now, but when I started from dental school, I hated rubber dam. We used that horrible green latex one that kept tearing, right? Yeah. Then I moved to that horrible purple one that it's impossible to tear, but it's just it's the ribbed one. I think it's latex free, one of those, right? Yeah. Hated that as well. Then I found the Unodent one, which is the latex free, and that's been phenomenal for me. Is that what you're recommending? Is there something better? And how important is it to use the right rubber dam for the experience as a dentist and maybe even as a patient?
You always have your preference towards materials. So the two that kind of seem to be a go-to is the Unodent or Nictone. And I like the Unodent. And it just works in my hands. All rubber dams can tear. Okay, but then that's based on, often it's maybe not punching the hole clean enough, maybe leaving too little distance between hole punches, and then even sometimes it's often the way people manipulate it between teeth, often not being patient and sometimes being a bit too aggressive with floss, which pulls tears. That can often be the biggest problem. So first it's learning how to use it, and then after that it's preference. Now I like Unodent purely on the basis I use a heavy gauge. Benefit of a heavy gauge is you get quite nice soft tissue retraction, easier to invert and everything. But then also from I guess, photography and things. It gives quite nice contrast when you're taking your images and things. So I like that side of things. But again, it's preference. I mean, if you speak to endodontists, I think some of them suggest that Roku down the, that purple ribbed one, because I think
for single tooth isolation, I can definitely see the advantage that it's very quick, easy, it's got a lot of give in it. But for multi-tooth quadrants and stuff, I found that a nightmare personally, because it is quite thick, and to floss it through is not as nice. So from trial and error, I'm glad we reached that same conclusion about our rubber dam choices. But use whatever you want to. And I think sometimes you have to go through the difficult periods to realise what you like.
You've got to give everything a try. But I'd say, if you want to start a good place, try the Unident heavy gauge.
If you're getting frustrated from your rubber dam, it's probably the rubber dam as well, adding to the frustration. I just felt that way with the green one. I felt a massive shift when I switched rubber dam. It became easier and quicker for me.
Yeah, it's sometimes it's the small little details of rubber dam that actually make the biggest difference. For example, we talk about the size of the sheet. People don't realise they come in different sizes. And that can influence maybe how tightly you're stretching it over the frame or how much material you have to play with. Because you can imagine if you've got something stretched quite tightly, it's like an elastic band, I always say. So that then makes it more difficult to manipulate. Whereas if you've got something with a little bit of give, it's easier to manipulate around clamps, through teeth. So it's just little things like that, the nuances, I guess, that make the rubber dam placement then a lot easier.
Just get out there, everyone. Start using more and more rubber dam to get that sort of hand skill that's necessary, along with your nurse. Do you get your nurse to floss, or do you floss?
My nurse, essentially, what she'll do is, once I've got it in place, she'll kind of stretch it over the contact area. There's some contacts it just drops through. Some areas it doesn't, but she'll stretch it. So essentially, by stretching it, she's thinning it out, holding it there while I gently pass the floss. Again, so it's teamwork, and you can. In terms of learning it, you can do it yourself. I did it myself. You don't have to go on a course. But I always think, and the way I've kind of got better at dentistry is like, why sit there and make a million mistakes? Why not go to the guy who's already made those mistakes, and you can fast forward that process? Hence the courses. Stand
on the shoulder of giants, and I mean that in your case. Your isolation I see is absolutely phenomenal. I message Harmeet sometimes. I've got this clamp. Can I modify this clamp in this way? And instantly his response is like, yeah, go for it. So I trust we have to say with that. And it's like you say, instead of wasting that time, that embarrassment with the patient, just get a head start. And when you feel more confident, the patient can detect that.
100%.
So my next question, Harmeet, is, if I can load this. So a lot of dentists advocate using the IsoVac or the IsoLite, which is, for those who don't know, it is it's like a mouth prop, but it also has something that sort of pushes the cheek out of the way, pushes the tongue out of the way. It's good. I've used it. My bias is still towards rubber dam. Even financially, it's a better thing to use rubber dam than IsoVac unit per pouch, because it's single use. But what's your view on that? Someone who's like very pro IsoVac will never use rubber dam because of it.
I've used IsoVac, and I got it in the last practice, and it was good, but again, expensive. And actually, I just found sometimes they're a little bit faffy to put in. I don't think they're always that comfortable. People think like, they're going to be very comfortable, but actually, there's a lot going on in the mouth. Sometimes it's just easier to use rubber dam, and issue I found, I still found access wasn't that easy with the IsoVac in, because you were kind of limited to the angle of your approach, if you know what I mean. You could only, it kind of makes a slightly narrow working corridor for you, so you can only really approach the arch in one direction. So, only time I found it useful was for like kids.
Okay.
If you're doing like Fisher seals and things like that.
Yeah, that's good.
That's the only time I found it useful, but otherwise I just found rubber dam just easy, quick, cheaper.
See, that's what IsoVac people say. They say, it's so much easier than using rubber dam, but it's what you've been exposed to and what you give an opportunity to.
Yeah.
I think for the complete beginner, IsoVac may be easier to use than the nuances of rubber dam and going through the sort of the pain of the learning process. So I can see the entry point into IsoVac easier. But here's my argument with those who use IsoVac and IsoLite is, when you've got your IsoVac in, okay, and then let's say you're doing a DO on a lower 6, okay, and it's getting close to the gingiva. How many caries lesions are we restoring that are not near the gingiva? Very few, probably, No. Often you're doing the wedging, and then there's a bit of bleeding happening, right? And then you put your matrix in, and you're just having to whisk away some blood. If you just use rubber dam to compress that papilla, that bleeding issue is gone. So I think as a macro isolation, IsoVac is great for the tongue and cheek, but on a micro level, for the hemostasis, nothing beats rubber dam.
No, agree. No, rubber dam definitely. Entry points. I mean, I guess entry points in terms of ease of use, but I guess financially, isn't it? I mean, unless you've got nice principals who want to buy it, or if you're prepared to fork out as an associate. But rubber dam is just
I think my principal was happy that I've started, even though we had IsoVac, that I stopped using it and I just use rubber dam. I think I was saving it's £2.50 a pop or something like that. Something crazy.
You spend it somewhere else.
Like that. Right. So last couple of questions then. When you teach your courses and you have delegates of various experience levels, sometimes as an educator you realize something new that you didn't know, that your delegates either had a learning need that you didn't realize maybe, or that in the real world your delegates might be struggling with something that you maybe hadn't considered. So what are the most common mistakes you see people make when they're on your course, hands-on, they're isolating, that someone could be making Monday morning, or if they're listening to this podcast, say, oh yeah, you know what, Harmeet's inspired me, I'm going to start using rubber dam now in practice. What's the most common mistakes to look out for that you see?
Okay. So in terms of delegates, I mean, I try and be quite good to the delegates in terms of, one, before they come on courses, I kind of email everyone and say, listen, if you have any questions, specific questions, just send them to me. Any struggles, because it kind of gives me an opportunity to look through my lecture and say, all right, is this covered? And to be honest, it generally always is. If there isn't, I always say to people, I will then add something in, a slide, okay? Or if it's something on the day that they come up when I'm like, actually, no, I haven't thought of that. I'll all right, let me look into that, and then I'll get back to you. So I try and be helpful in that way. In terms of how I pitch the day, I always pitch the day in terms of, listen, I don't know what anyone knows, really. So I always start really basic. And then I think, because then actually, even in the basic bits, people actually say, oh, actually, I didn't think about that. So go through the basics, then ramp it up towards the end of the day. But then, in terms of mistakes that I see people making, hands-on. It's sometimes, it's not the actual hands-on. It's I think flossing sometimes, actually. Flossing the dam through contacts. Actually, as dentists, we can be a bit overly aggressive with it. We're just trying to get this thing through. And sometimes we actually create more headache for ourselves because, one, it can hurt the patient. Two, if you just force the rubber dam down too quickly, all that rubber dam might not be through that contact point. So what essentially happens is you've got floss and then you've got rubber dam wrapped around it. So what happens? You pull that floss out, rubber dam pulls with it.
Have you got a photo of this?
I haven't got that.
It's difficult to put that one because you're just frustrated as hell when that's happening.
But I think most dentists would have that situation where they floss through rubber dam.
If you use rubber dam, you would know exactly.
And you've pulled it and you think, why is the rubber dam pulling with it? Or you pull it hard and then it's just torn it, hasn't it?
Tearing,
But often it's more rather than the actual hands-on. What the mistake dentists make is rushing. We sometimes don't. I talk about a checklist. So Ian's talked about the Checklist Manifesto is a good book, and having checklists for everything, because they're liking it to aviation, right? A pilot might have flown for 30 years. They still go into their cockpit and
they have a co-pilot with them,
and they have a checklist before they take off. And it's not an exhaustive list, but it's the main points. That's the reason why it's the most successful industry. If a plane crashes, we hear about it because it's so rare. Then they find a black box. They want to figure out what went wrong, don't they? Why not apply that to dentistry? Actually having a checklist, again, not exhaustive, like they say 5 to 7 point list with the main points. You've got some structure for yourself. You've got some structure for your nurse. You all know what you're doing. Actually makes you more efficient. But sometimes you can give people that checklist, and we do during the course, but then sometimes they start skipping. Like skipping a step.
That's when you run into trouble.
And that's when you run into trouble because you realise, actually, I haven't completed that first step and I'm jumping onto the second. And then you jump on the second and you realise the first step's coming undone. So actually, I say, if you actually just spent a little bit of time making sure you've achieved each goal, actually the process just becomes a lot more streamlined.
But when you become slick, then you can do it intuitively. But I think when you're learning out, having a checklist like that would be, I think, very invaluable.
And even though actually when you're slick at it, you still need a checklist, because the other thing that happens with human beings is we sometimes just go on autopilot. We can all have a bad day.
Unconscious competence.
Exactly, yeah. We all have a bad day, so sometimes you need that kick up the backside just to remind you.
Sweet. We're going to start wrapping up now in terms of all the tips you're giving. I'm going to ask you two things now. One, I'm going to ask maybe a more experienced question, okay, and how we can get around that. And then I'll ask you for the best tip you want to give us to the listeners in terms of a little hack you can share with us. But the first question is, when we're isolating molars and second molars. That's one of the most difficult things we can do.
Yeah.
So something I struggle with a lot.
Yeah.
What advice do you have with that? And also in that situation whereby when you put a clamp in, let's say you put a clamp on the 7 or even sometimes a wisdom tooth, but there's no space because the coronoid process is in the way. And often I get the patient to go move their jaw all the way to one side.
That's it.
Okay, but it causes, I'm just worried about, causing pain problems. Is that the only way? Is there a better way? And then generally on that topic of isolating molars, what nuggets can you give us?
So first, just get a good clamp on the tooth first, because if your clamp's not secure, it's going to pop off, and we don't want that. So generally for things like 7s and 8s, you want one of the kind of, I'd say, metal clamps. So I use these Coltine clamps. They're called gingival retractors.
Have you got a photo?
I've got a picture actually of a few. Let's have a little look here. Let's share the screen with you.
I think you're sharing already.
Oh, okay, brilliant.
Yeah, I'll just...
All right, so here we go. So these are the kind of Coltine clamps, if you can kind of have a little look there, okay? So generally they come as a B1, B2, B3. There's also a B4. B1's generally lower molars. B2's upper left 7s particularly. And then B3's generally upper right 7s. Because you can see there's like the difference in, the beaks of the clamp, different widths. And that's normally because 7s have that kind of triangular shape.
Yeah.
Okay. So these are they clamp a bit more aggressively, so you get better grip on the teeth. So these are brilliant for that.
So these are not your primary clamp; they are additional retraction, or can they be used?
No, that's the primary clamp. That's the primary clamp that goes on first. And you always want to just put your clamp on first, check it's secure. All right, then you know you're off to a good start. Now, then the next bit is just manoeuvring it over. And like you said, often it is. It's like when you're doing extraction, isn't it? You get that patient to move their jaw slightly, it gives you this little bit of wiggle room. All right, maybe even close slightly. And that's the second tip. The third thing is just having, like I said, not stretching your rubber dam sheet over your frame too much. Okay. So I see people. It has a bit lax. Exactly. People stretch it over the frame so tightly that it's got no give in it. They're almost trying to pierce the rubber dam. Actually, all you just need it to do is grip on. Because then by having excess, like having it some give in there, enables you to get it over the bow of the clamp.
Fine.
Yeah. I always use the analogy of like feeding paper through a printer. You're just feeding it over, and then you've actually got time to flick it over. If it's too tight, every time you try and get it on the bow, it flicks back off.
Yep. Definitely been there.
And also, if you had a loose clamp and you've got that much elastic energy in there, it's going to ping the clamp off, isn't it?
Yeah.
So that'd be my tip for that one.
Fine. And then what is your hack that you can share with the listeners about rubber dam? What's the main one of your pro hacks?
Let's give a little hack from one of the lectures. Here we go, because there's so many. So people ask about stents when you're using a putty stent for your composites. My rubber dam and my clamp gets in the way. So I always say, well, start backwards. So if you've got your model of your wax up, what I'll do is decide, say if you wax, let's for this example, say we're doing composite 3 to 3. Okay, you always, you're going to obviously have your stent to encompass 3 to 3, but you need something for your stent to sit on. You need your stops. So you're thinking, all right, I need to rest on the 5s and the 4s. So then you've got to think, all right, I then need to put my clamps either on the 6s or the 5s.
Yeah.
Okay. So what I'll actually do is I'll get my wax up model. I'll put my clamps onto the model.
Like you have done in the photo.
Yeah, that's it. And then I'll put them on. I know they're the clamps I'm going to use, and then I'll just make my putty over the top of that. And then I can see how I've just cut that back then. So I then know when I go and put my rubber dam on and everything, I don't have to mess about adjusting things because I've already done it in advance.
That awkward scenario where you realize, it's not going on, and then you then go in the back and sort of guesswork trimming, whereas yours is very predictable. Is that it gets rid of that bit of stress.
And it takes, you can do it quickly in your lunch break. It's just you've saved yourself like 5-10 minutes of just messing about in the mouth, and you can actually just crack on and do the work that you need to do.
Amazing. Well, I think we've covered a good few reasons to use rubber dam, a good few reasons not to use rubber dam, how to accelerate your sort of experience and learning rubber dam, which rubber dam to potentially use. Go out there Monday morning, start using rubber dam, build in the extra time. If you need a bit of help, Harmeet's always available. I'll put on his link to his is it Eventbrite use or whatever?
Yeah, or just contact me on social media if you want. We do the courses around the country, but even practices now. We go and teach practices, teach teams. So whatever you want, really. Just
brilliant. Well, it's a great thing you're teaching. I think it's so nice to see good isolation. I think the patients benefit. I think we as dentists and the wider team benefits overall. So thank you for coming on, man.
No, thanks for this podcast as well. Actually, I really enjoyed it. I mean, yeah, listening to people like Tiff and. You've had some great guests, actually, haven't you?
I've been very fortunate that people are sharing their sort of what they do day in day out, and I think it's been good for learning points, including this one. And thanks for doing it in a video format, so I can then share a few snippets from your slides. I really appreciate that.
That's it. Yeah,
Thank you.
Glad I put some makeup on.
So as always, a big thank you to our guest for today's podcast, Harmeet Grewal. I'll catch you in the next one with Lewis McKenzie, but in between between this episode and that episode, I'll also have a little bit on what to include in your portfolio and your CV for those, especially in DF1, in such a difficult scenario for everyone, but especially, DF1s, because, you're the least experienced dentist in the country, technically, right? And then now you're having all this downtime, not having the ability to refine your hand skills, and then you're potentially looking for either a DCT position or an associate position. So I prepared a little bit of content for you in terms of, I'll show you my CV and my portfolio, which had landed me some good jobs before. So I'm hoping that's going to help you out in terms of ideas. And thanks, as always, for listening all the way to the end.